How are HIFU, high-intensity focused ultrasound, and Pelleve different? Dear expert doctors, can you please explain to me in basic terms the difference between HIFU and Pelleve? What advantages or disadvantages does one have over the other? Do they both help in giving a non-surgical facelift? How long do the results last?
Thank you for your question. You've submitted a question without a photo, and you're asking what's the difference between high-intensity focused ultrasound versus Pelleve, and do they both essentially lift the face? Well, I can certainly help you understand this type of confusion, which is very, very common. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have integrated in my practice many non-surgical modalities to help my patients look their best. And from the beginning of the first CO2 lasers back in the mid-90s to the more modern non-invasive methods, including laser-assisted thermal tightening and radiofrequency thermal tightening. So I can certainly give you an idea of what the principles are and how to distinguish the outcomes that most people are really looking for. You see, one of the challenges in our profession, once the proliferation of devices and other modalities to help people improve their appearance became multiplied in our field, that the strategy of device manufacturers is very similar to the strategy of pharmaceutical companies. And what they would do is essentially market directly to patients and then trying to create essentially demand for their product before doctors, clinicians, not the doctors who do the studies, but the clinicians get a sense of whether or not these devices work as proposed, or whether or not there's a lot of hot air behind them. Well, essentially, the flavor of the past couple of years was high-intensity focused ultrasound, and one particular product created so much buzz and was featured in multiple media outlets. And in the past couple of years, and almost as quickly as it came onto the scene, within the past couple of years, as I had initially predicted, the results have become challenged and disappointing because even though the manufacturers often don't claim to provide results that are the same as surgery or surgical facelifts, there's no shortage of the insinuations and implications made of a non-surgical facelift. So before you decide whether or not one particular device is better than another for your needs, I think it's very important to understand facial aging. Generally speaking, these devices, these name brands are sought after by people who are seeing their facial aging process transpire, but they want to avoid surgery. Fine. When you think about facial aging, what are the two things that matter that are the results of facial aging? Volume loss. That means bone loss, muscle, fat, soft tissue. Then sagging, soft tissue descent, weakening of the tissue as well as the connections of the underlying tissue. Now, the idea is that if you heat up the skin to a certain temperature, what you are doing, scientifically speaking, is you are inducing a collagen remodeling response. Although there can be some potential tightening effect, there isn't really a predictable and consistent lifting effect. And in no way does any radiofrequency technology or heating technology, whether it's radiofrequency, high-intensity focused ultrasound, or long pulse width laser devices that induce heating, it's still about shrinking and remodeling. So you can get improvement in skin tone, you can get improvement in quality, but you don't necessarily get a vertical lifting. Now, one of the things that I would present in this discussion to my patients who have asked similar questions is what I'll do is I'll take their photos and I'll place them up on the screen for front view, three-quarters, side views. And I'll show them that essentially what they want often is to pull upward. They do mirror lift, very common action people do at home to see how much better they would look. Well, at a certain stage, and this is often the 40s and 50s, and even late 30s, and even as late as the early 60s, the volume loss is what dominates the issue. And so it's like the structure underneath has shrunk, and people believe that the skin has sagged. An alternative to these devices also is a procedure we perform in our practice called structural volumizing. With structural volumizing, what we're doing is we're placing long-acting fillers, such as Juvederm Ultra Plus or Juvederm Voluma, at the bone level. And by placing it at the bone level, we're restoring volume in a way that actually creates the effect of a lift. Why? Because when you restore volume in the cheeks, the jaw angle, the jawline, the chin, you're actually creating a reinflation of lost volume that often really looks like you've had a facelift. A strategy then could be to combine structural volumizing with some skin soft tissue remodeling using thermal energy device. I think that it's very important to ask critical questions about this. When you get down to it, the principle behind any device, whether it's Pelleve, high-intense focused ultrasound, is about heating the skin to a critical temperature and then having the skin respond with remodeling of the skin. So in that respect, essentially you're looking at basically similar outcomes, even though different styles of delivery. So I think it's important to have a consultation by an unbiased doctor. What's an unbiased doctor? Someone who can do pretty much everything, may or may not have these devices in their practice. But I find that when people get, let's say, convinced to get one of these, getting a very expensive device in their practice, they end up having to use those devices. A lot of times doctors will lease the device and the device will be in their office, and the hype pushes the sale of the device or the leasing of the device, and then when the hype dies away, they're stuck with the device. So you have to take things with a grain of salt. Be specific about what kind of outcome you want to see happen. And I would predict, as an experienced practitioner over 20 years in practice, that once someone lifts vertically like this and improves their neck and jawline, that's not going to happen with a thermal energy device. It just doesn't work that way. When the face is lifted, when we do surgery, we are lifting not just skin, we are also repositioning soft tissue and muscle-related tissue. That's a lot of work to move and then remove excess skin. Even the most conservative facelift, there's a fair amount of skin that actually ends up being redundant. So you're not going to get those kinds of results with a thermal energy device. One of the things, just to close the whole loop about the strategies for facial aging, when we do surgery, we do it under local anesthesia with light sedation. And that has been a real big step for helping people overcome their hesitation about having facelifting surgery, because we do these procedures with local and light sedation and avoid general anesthesia. But even if you choose never to have a facelift, you have to then decide what really matters most for your appearance, and understand that there is always room to have a sense of achieving a certain goal that meets a desired range of expectations. You can't get surgical results with non-surgical solutions, but in the modern world, when we have volume, opportunities to improve volume and do other things to improve skin quality, we can certainly do a lot of things that are non-surgical and that can't be done with surgery. So there really is a potential opportunity for synergy when you put the right modalities together. So I hope that was helpful. I wish you the best of luck, and thank you for your question.